Restless Legs Syndrome, also called Willis-Ekbom Disease, is a neurological disorder that creates an irresistible urge to move your legs. This urge is often accompanied with abnormal sensations in the legs, which are often described as crawling, tingling, or itching. These sensations typically get worse in the evening or at night when you're trying to relax or sleep. What makes RLS particularly interesting is that moving actually helps relieve the discomfort temporarily, but the sensations return once you stop moving. Think of it as your legs having a mind of their own. They demand movement when you're trying to rest. You might be surprised to learn that RLS is actually quite common. It affects about 7 to 10% of people in North America and Europe, with women being more likely to experience it than men. The condition can start at any age, even in childhood, though it's more common in middle-aged and older adults. What's particularly interesting is that many people with mild symptoms might not realize they have it or might not seek medical help, so the actual numbers could be higher. Types of restless legs syndrome. RLS can be categorized into two main types based on its cause. Number 1. Primary RLS. This is the most common form, also called idiopathic RLS, because it often has no clear cause. It tends to run in families and usually starts before age 40 and may worsen gradually over time. Number 2. Secondary RLS. This type develops as a result of another medical condition or certain medications. It's often referred to as acquired RLS because it typically develops later in life. In most cases, treating the underlying cause of secondary RLS often alleviates the symptoms. Causes of restless legs syndrome. The causes of RLS can vary significantly, and often multiple factors may be involved. Number 1. Genetics. If you have family members with RLS, your risk is higher. In fact, about 40% of people with RLS have family members with the condition. Scientists have identified several genetic variants that might increase the risk. Number 2. Iron deficiency. Iron deficiency is another major player in RLS, even if you're not technically anemic. Your brain needs iron to produce dopamine, which is a neurotransmitter that helps control movement and other functions. When iron levels are low, dopamine systems can go wrong, leading to RLS symptoms. Number 3. Pregnancy. Hormonal changes and iron deficiency during pregnancy can trigger or worsen RLS, particularly in the third trimester. Number 4. Medications. Certain medications, including antihistamines, antidepressants, and antipsychotics, can exacerbate RLS symptoms. Number 5. Chronic diseases. Certain conditions like kidney disease, diabetes, and peripheral neuropathy are associated with an increased risk of RLS. Symptoms of restless legs syndrome. The experience of RLS can be challenging to describe to someone who hasn't felt it. The primary symptom is an overwhelming urge to move your legs, but this simple description doesn't do justice to the actual sensation. People describe the feeling in various ways, like ants crawling under their skin or an itching sensation deep inside the legs where you can't scratch. Some people describe it as a pulling sensation, while others say it feels like fizzing, burning, or electric tingling. These sensations usually occur deep in the legs, between the knee and ankle, but can also affect the thighs, feet, and sometimes even the arms. What's particularly distinctive about these sensations is that they're usually accompanied by an irresistible urge to move. Sitting still becomes nearly impossible. All these sensations typically begin or worsen when you're at rest or sitting for long periods, like during a long flight or while watching a movie or lying down in bed. What's fascinating here is that movement temporarily relieves the discomfort. When you walk or stretch, the sensation usually diminishes or disappears, only to return when you stop moving. The symptoms also follow a clear pattern with circadian rhythm, typically being worst in the evening and at night. This timing can severely impact sleep, leading to insomnia and daytime fatigue. Many people find themselves pacing the floor at night or constantly moving their legs in bed, unable to find the rest they desperately need. Diagnosis of restless legs syndrome. Diagnosing RLS is primarily based on your symptoms and medical history, as there's no single test that can confirm it. Doctors typically look for 5 key criteria. Number 1. An urge to move the legs, usually accompanied by uncomfortable sensations. Number 2. Symptoms that begin or worsen during periods of rest. Number 3. Relief with movement. Number 4. Symptoms that occur or worsen in the evening or night. Number 5. Symptoms that aren't solely explained by another medical condition. To rule out other possible causes, blood tests are often performed to check for iron deficiency, kidney function, and other metabolic issues. Treatment for restless legs syndrome. Treating restless legs syndrome typically involves a combination of lifestyle changes and, in some cases, medications. The goal is to reduce the frequency and severity of symptoms while improving sleep quality. Number 1. Iron supplements. Iron supplementation becomes crucial when blood tests show low iron levels, particularly low ferritin levels. Iron deficiency is one of the most treatable causes of RLS. Doctors typically prescribe iron supplements if ferritin levels are below 50 micrograms per liter. These supplements are usually taken on an empty stomach with vitamin C to enhance absorption. However, iron supplementation should only be done under medical supervision, as excess iron can be harmful. Number 2. Lifestyle modifications. These are usually the first line of defense against RLS symptoms. This involves establishing a regular sleep schedule and maintaining good sleep hygiene. Consider using a weighted blanket, as some people find this helps reduce symptoms. Regular moderate exercise, particularly in the morning or afternoon, can also significantly reduce symptoms. However, intense exercise close to bedtime might worsen symptoms. Reducing or eliminating caffeine, alcohol, and tobacco can also help, as these substances can trigger or worsen RLS symptoms. Many people find relief through stress reduction techniques like meditation, yoga, or deep breathing exercises. Number 3. Medications. Dopaminergic medications are often the first choice of prescription drugs for moderate to severe RLS. These drugs, including ropinirole, pramipexole, and rodigotan, work by increasing dopamine levels in the brain. They typically start working quickly and can be very effective. However, there's a significant consideration with these medications. They can lead to augmentation, where symptoms worsen over time and may begin earlier in the day. To minimize this risk, doctors usually prescribe the lowest effective dose. Number 4. Physical treatments. These include leg massages, hot baths before bedtime, heating pads or ice packs, and pneumatic compression devices. Regular stretching exercises, particularly of the legs, can also help alleviate symptoms. Some people find relief through alternative therapies like acupuncture or weighted blankets. Number 5. Opioid medications. Opioid medications might be prescribed for severe cases that haven't responded to other treatments. Drugs like oxycodone, hydrocodone, or tramadol can be very effective in controlling RLS symptoms. However, due to their potential for dependency, they're typically reserved for the most severe cases or when other treatments have failed. When prescribed, they're usually given in low doses and carefully monitored. Number 6. Advanced treatments. In rare cases where RLS is severe and unresponsive to other treatments, advanced therapies like transcranial magnetic stimulation or intravenous iron infusions may be explored. These treatments are typically reserved for individuals with debilitating symptoms who do not find relief through conventional methods. At the end, remember, what works for one person may not work for another, and it might take some time to find the right combination of treatments. The goal is to find a sustainable long-term treatment plan that effectively manages symptoms while minimizing side effects. Now, we want to hear from you. Do you or someone you know struggle with restless leg syndrome? What remedies or treatments have worked best for managing the symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.